My name is Samantha Prust, and I'm a licensed clinical social worker here at the hospital. I was born and raised in Bailey's Harbor, Wisconsin. So I graduated from Gibraltar in 2009, and then I went to UW-Madison. So I was there for 4 years, and then I went to Green Bay and worked there for about 5 years doing home visiting. So I did in-home social services kind of work. And then I worked in Madison for 2.5 years before I came back here. When I think about my approach to practice, I wouldn't say I have like one set modality. I do a lot of like cognitive behavioral therapy, some like dialectical behavioral therapy. With my younger kiddos, it's a lot of like relationship-based work that involves their parents a lot of the time. I do have a lot of like training and background in like trauma-focused work, so understanding like how the things we've been through affect us and how that might be carried into like a lot of our present situations and dynamics. All of those things kind of come together to inform like the lens that I'm working through. I don't think that you can really take mental health out of physical health. I think that they're so intertwined that it's impossible to kind of sort them out. When I'm working with a client, we might be thinking about their mental health and like things that they've gone through and how that impacts them and their relationships. But we're also thinking about like their self-care routines and like, are they getting enough sleep and are they eating well? And we've come a long way as a society in understanding that mental health is a part of physical health, but I think we still have a long way to go. And I think that the work that we're doing just ties into all of that so well. When I think about what I'd want my patients to know about me, I would think just that like it's okay to ask questions and to, come into therapy with maybe some worries or maybe some hesitations. If you come in and you're open about those hesitations, like those are things that we can absolutely work through.